All right. Hello, everyone, and thank you for joining us to the Introductory RCBH webinar today. My name is Amy Tong, and I will be getting into a little more of that in the next few slides, but I just wanted to thank everyone for attending and let you know that this webinar is directed towards the new behavioral health teams formed to serve in a primary role within the RCBH project. So for some of you, this may be the first introduction to the project, and we welcome your attendance today. Others may have been involved in focus groups leading up to this point, so I would expect some of this material you may have heard before as well. Because we are recording this webinar, all attending are on mute to start, besides the CareChoice team. We will be taking questions for sure at the end of the webinar, though, so please just go ahead and click on the raise hand icon and near the end of the presentation, and we'll make sure to unmute you so that you can ask your question at that time. Thank you. All right, so to start out, I wanted to introduce the CareChoice team through RCBH. I'm going to move my slide here. And thanks. One moment, please. We're having technical difficulties. There we go. All right, slides were stuck. So at CareChoice, we have a team of 4 that are going to be leading the RCBH project, and so I just wanted to start with some brief introductions. As I mentioned, my name is Amy Tong, and I am the project director for RCBH. So I'm going to be involved in a number of aspects of the project, but primarily in assuring that we stay on track with project work and reporting back to DHS. I will also have a greater involvement in development of protocols and guidelines related to the project, and that's related to the education that's going to be provided. My background is that I'm an adult geriatric clinical nurse specialist and also have a doctoral degree in nursing practice, so a DNP. I have a background of working in the hospital, home care, and as a geriatric care consultant. And then prior to my role in leading PIP projects for CareChoice, I also worked as a nurse educator in a BSN program and taught med-surg, mental health nursing, and cultural diversity in the didactic lab and then in multiple clinical settings. Era, did you want to introduce yourself?
Sure. Hi, I'm Era Wanmacher. I'm the education director for this project. I was also involved in education on the RCMS project too, if you were on that project. My background is that I'm an RN, and I have a master's degree in nursing education. Prior to working for CareChoice, I was also a nursing instructor for baccalaureate students, and then I've done staff development for North Memorial and Abbott Northwestern. And then prior to education, I did kind of a stint as a clinic manager in a former life. So in terms of this project, I'm going to be focused on education primarily for it. So you've already heard a lot from me regarding the learning programs. I'll be developing materials to go with that, and then working with you on the behavioral health team trainings, and then everything that's involved in staff training. Thanks.
I'm Anna. I'm the social work coordinator on the grant. My background is in behavioral health, running group homes for high behaviors, or residents with high behaviors, and then also working in nursing homes. The biggest part of my job on this grant is going to be dealing with behavioral expressions and the interventions we put into place for that.
And I'm Stacy Ellerbush. I'm the program associate with the project, and I've been with CareChoice now for 4 years. This will be the 3rd grant that I've worked on, and I'll be assisting the rest of the team with day-to-day operations of the grant. And I'm a licensed social worker.
All right, thank you. You may also hear from Nicole Pellerine or Bill Knutson from time to time, who are our executive directors and CEO at CareChoice. So I just wanted to make sure you were familiar with their names if you haven't met them already. So Resident-Centered Behavioral Health, otherwise known as RCBH, is a 2-year Minnesota DHS-funded performance-based incentive payment project, or a PIP, with 21 CareChoice facilities that are participating. RCBH really came together over the course of the last year and a half through listening to the needs of staff from the nursing facilities involved in the last RCMS PIP project. Staff expressed a great need for a training of staff around management of behavioral health concerns that arise in the nursing home setting. So some of the things we're working on at RCBH include education around building relationships, therapeutic communication, and management of behavioral expressions, and then also developing protocols and interventions that address symptoms of depression, quality of life, and management of behavioral expression. Although some changes were made to the outcome measurements, which I'm going to discuss next, DHS accepted the proposal, which brings us to where we are today. So outcome measures for RCBH project are measured entirely through the Minnesota DHS quality indicators for depressive symptoms and behavioral symptoms, or as we're going to speak more about these behavioral expressions. We're also looking at the quality of life metrics through the Minnesota DHS on relationships, as you see on the slide here. In a sense, there's actually very little data to collect for DHS with this project, as most of this is publicly available, so CareChoice is likely going to gather information this way. The only data we will be collecting from the teams are going to be more around process measure data related to education and the protocols and interventions, just to make sure we're on track with the work throughout the project. Facilities will need to meet 2 out of the 3 outcomes as a collaborative and 2 out of the 3 of the outcomes as an individual facility. So this is set up a little different than it's been set up in some of the past PIP projects. The percentage of reduction for individual facilities range depending on where the facility started compared to the state average. So for example, with behaviors, your goal might be somewhere between a reduction of 5 to 20%. However, goals for reduction in depressive symptoms and behavioral expressions as a collaborative are to reduce each of these by 15%. Goals for improvement of quality of life around relationships as a collaborative is to improve by 3%. So again, depending on how your facility scored on these QIs and quality of life, this may seem like a bit of a stretch goal. But we know this project is going to take a lot of work and focus on the part of behavioral health teams to challenge the status quo. And so we really look forward to working with you in developing strategies that are going to improve these measures for residents at all of the facilities within our project. Although it's not technically listed as a project outcome, we are truly hoping that the education and communication around management of difficult behavior expressions really help your staff also feel more confident and comfortable with working with the many behavioral health concerns that arise in long-term care settings, and then allow for better care of residents as a result. So you'll definitely be getting a more in-depth introduction to the RCBH project at the end of April when you attend your first training. For now, I just wanted to share some basic tasks that will be accomplished by your team between now and July of this year. So as you can see, one of the first things that behavioral health teams will be working on is getting the behavioral expressions needs assessment. Now, I wanted you to know that this is something you're going to be hearing more about from your PIP Ops Committee member. We just introduced this to them yesterday at that meeting, and so you can expect to hear from them most likely in the next week. They will be getting that needs assessment to your team so you can start working on that. And Anna will be speaking a little bit more about that as well. The first behavioral health training is going to be in late April, and I saw that many of you have signed up for this already. We definitely hope that everyone on the team can participate in each of these sessions, but particularly those core members of the team. Training on the depression protocol will begin late May, and we would expect that the implementation of that depression protocol would start probably early part of June once that training is completed. And then the second behavioral health team training on the first 4 learning program modules would occur in June. And then throughout the course of the summer, there would be the development of a training plan for staff, which the behavioral health team would be working on. And another point I just wanted to note is that, we're going to be setting up communication kind of webinars for the whole behavioral health team on a monthly basis. around the first week of the month. We should know more by that first training what dates those are actually going to be, so that we have an opportunity for the entire group of behavioral health teams to communicate and ask questions and just come together. We may be releasing, information about the project at that time, but we just wanted to have some kind of a formal, more organized way of having everybody being able to communicate at the same time, knowing that you're on, you're miles and miles away from each other, and so getting together is going to be difficult as a large group. All right, Era, did you want to speak to some of the training that the behavioral health teams can expect in the project?
Sure. So this is Era. So the first training, like Amy said, for the behavioral health team is going to be either April 24th or 25th, depending on which session you're signed up for. And that first training is really going to go over all of the logistical kind of stuff about training and training your staff, and go into definitely more depth about the training plan and what's going to be happening when. What I wanted to do right now is just give you a real high-level overview of kind of what's going to be happening for your training when, and then what you'd be training your staff on. But again, we'll get into much greater detail at the end of April on this. So the first training, again, April 24th or 25th, and then there'll be another behavioral health team training in June. So that training will introduce the project, how you're going to do that to your staff. It'll also start talking about the first 4 learning program lessons. So those are bolded on there. There's a behavioral health introduction lesson, a listen, understand, and act lesson, trauma-informed care, and depression and anxiety. So those are the first 4 learning program lessons, and those are each about 15 minutes long. So we'll train you on what's kind of going on in the learning program, and then the materials that you'll need to help your staff with the learning program until lead discussions. So you'll see that in June. And then you'll start training your staff after that. So in July, August, and September, you'll use the learning program, and then you'll use discussion group materials that have been provided to lead discussions with your group. So I really just wanted to clarify that CareChoice is going to be providing the learning program and the discussion and really the education materials. So it'll be up to you and your team to then carry it out at your site. And we'll talk more about that in April. But I just want to kind of set the general expectation right now that this is going to be more than a learning program, that there's a lot of concepts kind of behind everything involved in the learning program that staff need to really experience and practice. So there's going to be things besides the learning program that will need to be involved in staff training. So Amy, if you want to flip it to the next slide, please. All right, so then we'll have another behavioral health team training in September, and this will cover the next 2 learning program lessons that are, again, 15 minutes each. So you can see we kind of are building on the content now that was previously learned. So there's a behavioral expressions and introductions lesson, and then a behavioral expressions management lesson. So we'll go over those at the training in September, and then again in quarter 4, October, November, and December after that, you'll be working with staff on those learning program lessons, and then you'll also be practicing techniques learned in those lessons with staff and then checking them off on competencies. So that we'll talk more about too. All right, I'm going to flip to the next. Thanks, Amy. Okay, so then the last behavioral health team training that we have planned for this year would be in December, and then you'd train the staff on that content starting in 2020, so January, February, and March. And the final learning program lesson that, again, is 15 minutes long is going to be on de-escalation. And then just like the behavioral expressions, this will involve practicing simulations with your staff and then checking them off on competencies. So that kind of gets us into the beginning of 2020. After that, the learning program lessons will have been completed, and really we'll start focusing on what specific educational needs there are at your facilities. And we'll base that on the behavioral expressions needs assessment that Anne is going to speak more about in a few slides. So I know this is a very high-level overview and really doesn't get into a lot of detail, so that will be coming more in April. And again, CareChoice is going to be providing the learning program and the materials. So it'll be your responsibility and your team's responsibility, which I think is different this time. There's more than just one person available to do education, but it'll really be up to you and your team to kind of figure out how is this going to look at our site. So I'm looking forward to meeting those of you that I haven't met already in the end of April. Thanks.
All right, thank you, Era. So all of this training is meant to be aligned with changes in care that affect practice and is evidence-based. So CareChoice has started working on developing a depressive symptoms protocol that will be used by all the facilities in the project. Some of the data that supports this, as you may know, is that 5 to 25% of residents in long-term care experience major depressive disorder. And the literature shares that up to 29% or more experience depressive symptoms. In addition to its high prevalence, depression and symptoms of depression affect quality of life and functioning. Our goals are to assess residents that meet criteria for being at moderate and high risk for depression by an interdisciplinary team, and then having the behavioral health team meet on a scheduled basis to discuss strategies that look at personalizing activities, developing opportunities for socialization, and then exercising. Separate from working with the facilities in RCBH on the depressive symptoms protocol, we're also looking to work with medical directors at the facilities to develop a consistent guideline that providers are using to inform care around residents with symptoms of depression, and one that aligns with that facility depressive symptoms protocol.
Okay. So as we said, we developed a behavioral expression needs assessment, and we went over it with the PIP Ops committee yesterday. So what it really is an assessment for the behavioral health team to collect and analyze data on your current processes within the facility related to behavioral expressions. As you see, it's due May 31st, and after we get that back, then the CareChoice team will analyze the data so that we can help you guys create a psychosocial assessment, documentation strategies, care planning strategies, structured behavioral processes like rounds or meetings, and then identify what educational opportunities we have for year 2.
Thank you, Anna. And one thing to mention about the behavioral expressions needs assessment is that the hope is that the results from this is there will be some things that will be the same with all facilities, but we also expect them to be more individualized based on what we find from that needs assessment. That depression protocol is meant to be done in a similar fashion throughout all of the facilities. So the two interventions or protocols are kind of set up a little bit different that way. So prior to April, CareChoice has been meeting monthly with the PIP Operations Committee, who are responsible for building and supervising the behavioral health teams. So some or all of your behavioral health team has been identified as the core team for which the PIP operations or the PIP participation expectations apply. Core team members have been identified by PIP Ops committee members so that CareChoice can monitor effectiveness of the teams throughout the course of the project. And most of the time, the core teams are going to be the social work and nurse assigned to this role, but other teams may have all participants, such as the TR and the chaplain, involved as core team members. So essentially, all the participants of the behavioral health team are going to be invited and encouraged to attend trainings, participate in implementing processes, and communicating with CareChoice throughout the project. However, those core team members are going to be expected to be present at all trainings and lead project work to assure facility and collaborative outcomes are met. So within every behavioral health team, a project manager has been identified who will also be a primary contact around data collection and reporting to DHS every 6 months on progress. Just to give you some ideas of dates for that first DHS progress report, the first one is going to be due to CareChoice by June 14th. Unfortunately, we aren't going to have that new form for 2019 available until after June 1st. So one of the things we may do is share a prior form so that you can get an idea of some of the questions that they would be asking, and then know that the final form won't be available until shortly after that. So just to give a little bit more detail around participation expectations of the behavioral health team, communication. So one of the things that we're looking for behavioral health team core members to participate in is attending site meetings when they're set up, whenever possible. You know, we would ask that you communicate when you're not available on a long vacation. You know, if you're gone for 3 weeks to Hawaii, that is awesome. Just make sure you let us know that, so we're not wondering why we can't get in contact with team members. Appreciate if we get responses to emails within 1 to 2 days, responses to phone calls within a day or so. Around education, we're looking for core team members to participate in all training around education and the learning program. We're looking for them to fully participate in required staff training and demonstrate the ability to assess and record staff competency. And then around the protocols and interventions, we're really looking for that core behavioral health team to participate in protocol or intervention training and building of those protocols, as well as reporting process measures in a timely manner, develop measurement and auditing strategies for some of that behavioral expressions work. So this completes all of the content that we were planning to provide in today's webinar, but before I have questions or open it up for questions, I wanted to make note that attached to this webinar are 3 handouts. You're going to see a handout of the webinar itself, a PowerPoint, and then the training plan for education. If you want more detail on that training plan, that is attached, as well as more information on some of those outcome, the measurements for this project. So you have more detail on the Minnesota DHS, QIs, and quality of life information. So again, at this time, we would like to open it up to questions. And again, everybody is on mute. So if you could just click on the icon on your computer that says raise hand. If you have a question, we'll go ahead and unmute you so we can hear your question.
Oh, there's one.
Okay. Lori. Okay, Lori, we have you unmuted. So Lori Scow, did you have a question about any of the work coming up? Okay, I apologize if you're speaking. We can't hear you at this point. If you're on your computer audio, you may want to, it may work best through a headphone. Anyone else? Okay. If you're able to type in the chat box, Lori, since we are not able to help you, that would be another way in which we could respond to questions here. All right, otherwise I'll wait another minute, and you know, our emails are listed on the webinar PowerPoint, so please feel free to email. I think we saw another hand raised.
They were typed in the questions pane there.
Should I click that?
No, just click on that questions pane there.
Okay, the question is, when do you think you will have the June training dates? Era, are you able to speak to that?
Yes, I am currently, I have a couple of rooms booked and I'm just waiting for a few other rooms to open up. So we're using library facilities, so they have kind of time constraints on when the rooms are available. It's generally 60 days. So I'm just waiting for all of the dates to open, and then I'll get those dates out to the PIP Ops committee team to go ahead and register staff as soon as possible.
All right, thank you. Are there any other questions at this time?
Oh, there's one.
Oh, we saw another one.
Oh, no.
Okay. All right, if there aren't any more questions, I think we'll go ahead and close the webinar, and we'll make this available, the recording for, oh, we have another person. Okay, one moment. Marilee, we're going to unmute your phone here. Marilee, did you have a question? Hi.
Yeah, I just wanted to offer up, if you'd like to contact me, we can offer up our chapel area for one of the larger meetings since we're centrally located.
Okay, thank you for that.
If you want to contact me later.
Thank you. How many seats do you have, just off the top of your head, do you know, in the chapel?
How many seats?
Yeah, approximately, or?
150, 200.
Okay, thank you.
You're welcome.
All right. Well, we don't see any more questions here, but again, if you have questions before the next trainings, please feel free to email any of us that are listed on the PowerPoint. And I think we all look forward to meeting you in a couple of weeks and appreciate you attending today. Thanks so much.
Thank you.